There are a multitude of stretches intended for people to gain flexibility on their hamstrings, and many of them are non-specific. By non-specific, I mean there are other structures that are getting tension upon them other than the hamstrings. A classic one is the patient bending forward and reaching and touching their toes, feet together. Just bending down and touching their toes. Okay, so for one thing, we have the load of gravity on the spine and the spinal joints winding out, as well as the pelvis moving forward and then supposedly getting the hamstrings, but with the knee locked and the foot at a position that's 90 degrees at the ankle joint, the likelihood of doing damage to stretching a nerve is higher than if we were to do it an alternative way. Another way of stretching that is commonly seen that is also very controversial for us is with the legs far apart. And with the legs far apart, then the person goes and tries to stretch their hands to one foot. And then in doing so, all the risks that we talked about are heightened further, because with this side bending, there's even more risk to the back. And back up. And then if we were to look at other dangerous hamstring stretches, or so-called hamstring stretches, we would see the classic one where the patient sits on the floor and puts their legs out that way. And then in so doing, now sitting pressure, which is much greater on vertical loading the back than standing, is heightened in the sitting position, so this stretch is even worse than the standing one. And then with her then trying to bow her head and feeling the stretch all the way down to her feet is dangerous for the nerve, because that's the structure we think that is felt when the patient takes their spinal cord, lets the head flex, and then they have the knee locked straight and then pull on the toes or grab the feet, or worse yet, have a personal trainer come behind them and press, to put great risk on the ligaments of the back, on the disc pressure on the back, and then great risk to the nerve coming out of the back to the foot. So 3 structures: disc in the back, ligaments in the back, and the nerve traveling down to the foot at high risk. If the patient puts their feet out to the side, so they're split, and then they rotate and twist, we know with rotation, the pressure on the disc is even greater than just bending forward. We also dislike the classic hurdler's stretch, where this foot would be out straight and then this knee would be bent. And then the person would be told to go down and touch their head to their knee, or grab the toes and pull them back toward you. So we know the nerve is on stretch and at high risk, as well as the torsion in the back, as well as the ligaments being at risk, and the disc pressure being exceedingly high. Younger people can get away with this as their disc is in a youthful part of their life journey, and for people past 35, this would be very high risk. As an alternative to creating a stretch for the hamstrings that does not put the back at risk, the disc in the back at risk, or stretching ligaments, as well as not stretching the nerve, we would have the patient between 2 pieces of furniture, possibly, for unweighting of the back through the use of the arms being supported by the 2 pieces of furniture. We would tell the patient that their toes must always be on the floor, so the nerve coming out of their back, going down their leg and to the toes, is on slack. If the toes are pulled up, the nerve could be at risk. The other thing is that the patient's pelvis is not twisted, but make sure that the side that has the knee on the pad does not twist backwards in relation to the opposite side. The other part of the spinal positioning is that they would take the bottom of their sternum and arch it forward to their front knee to use their back extensors to maintain mid-range of all these spinal joints to be at low risk and no ligamentous stretching. When she's in this position, not only may she feel it in the hamstring, in this case on the left, but there could be a stretch to the right hip flexor, which is a second stretch that would be done in this position and not at risk to the back. When the patient reaches a higher level of flexibility, the furniture is taken away and their fingertips are on the floor. And as the fingertips are on the floor, then she uses her back extensors to take those muscles, activate them so that her sternum stays forward and she feels the left front lower ribs contact her left thigh and maintain that contact at all times so that target is specifically to the hamstring and avoiding any risk to the back ligaments, disc, or the nerve going out from the spine to the foot.